first time doing breath work on top of acupuncture. Overall, the feedback, I mean, is 100% positive feedback. We had 8 patients that day. I just want to quickly walk through them and see, because each patient's scenario is different, and
Yes,
I just want to recap on every one of them, what they have felt. So our first patient was 68-year-old female. She was having asthma.
Yeah.
So our goal having you in the clinic was, on top of the acupuncture treatment, that she could learn some skill managing asthma, not only in the clinic but also outside in the home, taking with her. And so she is very grateful after the treatment, and saying that she learned some really tangible skills taking home with her.
Yeah.
How did you feel about treating asthma with acupuncture that day? There are two scenarios.
Well, first of all, I felt and I still feel blessed to have the opportunity to witness this ancient art, I would call it, which translates into healing and holistic medicine. But first of all, I think it's an art because I was able to observe how you first sense through the heartbeat and different indicators in the human body, and then afterwards selecting specific points on the patient body.
Mm-hmm.
And in this case, I perfectly remember this first session because it was the first time for me to interact with another complementary modality and operator, of course. So I was engaged and interested in seeing how breathwork and acupuncture could complement each other. And in this case, I realized that what the patient was she needed the most was a tangible approach, as she described it, for relaxing and calming down the breath, especially in moments where asthma kick in. I want to be precise in defining what that particular type of exercise and breathwork technique could do, because treating asthma is something that I would more relate to what you did in terms of acupuncture.
Mm-hmm.
What I did was a support
Mm-hmm.
in teaching this woman to basically engage the diaphragm and breathe in the belly, deeper, instead of getting caught in the feeling of not having enough air or not lung capability to fill up the lungs, and then having this short feeling of not being able to breathe all the way through. So I believe that a diaphragmatic gentle breathing can be very helpful for a lot of conditions.
Have you run into asthma in your own breathwork practice, just alone by yourself before?
No, not really.
Yeah.
Because I think that people who suffer from this condition, they don't feel like breath work can be something that they can do it.
Yeah.
Because probably they feel fragile and weak in terms of breathing, basically.
Yeah. Even though the lung is a primary function that regulates breathing and asthmatic pathology, I hope this patient will walk away. As a matter of fact, the second patient with asthma told me that she wants to start adding breathing to her daily practice to manage asthma. So it's really something that they take home, that now asthma can benefit from breathing.
I think it's very important for a breathwork facilitator to not to get caught in a ego-driven practice. By that I mean we don't treat condition, we don't solve conditions. We can support and give like practical exercises tailored to the specific needs.
Yeah.
But I would be very careful to say that breath work, as I teach it and facilitate it, treat a condition.
Of course.
So
I mean, even for our modality, I wouldn't claim that we treat asthma, but we definitely facilitate, the patient's own healing.
Yeah.
The second asthma, let's move on from asthma. We'll go to the next condition. So there's a young woman that came in with a lot of menstruation issue. I know this is something that you don't see very much in your own practice, and but she turned out to be one of the patients that was most interested in breathing after the treatment, and she felt so from what we're seeing from our modality, this menstruation irregularity contribute to hormone imbalance, stress, and then if you keep peeling onion, everybody's root cause is different. But because in modern days, stress and anxiety is so deeply buried in almost every patient's presentation, so she felt extremely well after breathing on top of acupuncture. Do you remember?
So like in this case, I feel much more confident in saying that it was extremely useful for her to approach conscious, gentle breathing, because there is an actual difference between functional breathing and the skills that take to basically anatomy and like how the body work, and this relates more to the to a performance functional aspect of breathing, which is not my main interest and preparation. Because what I do is more like allowing people to release tension, to release stress, and giving them emotional support tools to transform this anxious and this shortage of like not having enough with a practical tool like breathing. So in this case, I realized that she already with nasal breathing, which is supposed to just like center the person in the present moment, she was actually feeling a lot of stuff coming up and almost shaking to a point where I really felt like she would have benefited from like crying and let go of all that burden and probably pain and stress. But because of the gentle breathing, which is a very good first time approach, because we don't want to overwhelm people giving too fast too soon.
Yes.
And
yes. So from our perspective, a lot of menstruation root cause is related what we call qi stagnation. Qi is a vital life force flowing in us, in the body. By adding breath work to facilitate qi movement, definitely would improve the blood flow and reduce pain, reduce menstruation pain, you know, before or after the period, for this type of issue. And I want to touch on we saw about 3 very trauma-related cases, and that's one of the most important case I want to talk about. The first one was a young 20-some-year-old woman who lost her sibling to a traumatic event. After the treatment that we did jointly, I measured her chi before the treatment and measured afterwards. So she had a 25% jump on her chi,
Yeah.
uh, strength management. Measurement. So, and she was happy all day long, giggling after the session. I have never seen that before. So I thought that was very remarkable. And then the next trauma patient, she was the one I did a trauma protocol that day. If you remember, that's the one that I also burned some herb right here in the belly area. Yeah, and she was the biggest advocate for breathing after the treatment. She was telling me I want Niko's contact information, learn all about breathing. Yeah. Do you remember that one?
Yeah, I do remember, and I think that when you live in stress response, constantly hyper arousal and sympathetic nervous system activation ongoing. When you start breathing and you do it consciously for 10, 15, 20 minutes, as we were able to do with these two patients, they immediately start feeling they have an inner resource to transform all these blockages, all this stagnation, as you call it. And as a result, not only this vital force energy starts to flow much better, but there is also an increase in oxytocin and serotonin and all these neurotransmitters that actually are the feel-good hormones.
Yeah.
So there is also a physiological impact in terms of a boost in the mood and in all the feel-good sensations.
Absolutely. And then the last case I want to, we don't have time anymore. The last one I want to talk about is the last patient who came to me a year ago with severe digestive issue. A middle-aged, high-tech executive, and he, after the acupuncture and breathing session, he said that he had experienced 5 to 10 times more energy because he came in at the end of the day, and he did not expect after this session. He's a regular patient of mine, come almost weekly, every other week, right, for a long period of time. But because the breath work on top of acupuncture this time, he had a new sensation. He felt like he was quote his own, saying that his energy jumped about 5 to 10 times, and then it was the end of the day. But then after the treatment, he felt like his day starts all over again. Yeah. Do you remember that? Do you want to talk about something like that?
Yeah, I remember that. Also because this person was practicing breath work already.
Yes.
So we felt like we could go a little bit deeper, and so that's why I invited him to do mouth breathing, which is more intense for the body and nervous system. But since he was already into breathwork, I felt like that could be a boost that could add some energy and value, so that's why we did still a short session compared to what I do in my usual sessions. But I felt his facial expression and his willingness to communicate really rise to the top after.
Yes.
So what was interesting for me in having seen that many people in just one day, it was how important is to tailor and to suggest nuances of the breathwork techniques according to what's needed, and not imposing one and only one approach. Because we're all different and we live different moments and stages in our life. So I believe that this combination between breathwork and acupuncture just reinforce each other, and this could be like a start of a nice protocol that
Exactly.
many people could benefit from.
Yes. So I really felt that by having you in the room, it enhance a multi-dimensional experience, both mentally and physically for patients. The smell, the vibration, the breathing, aroma, and the full sensory experience really enforce a more profound and deeper qi movement.
Yeah, it adds definitely more layers to it.
Yeah, and then some of the comment people says that I really one patient walk away and I saw her smile for the first smile for the first time and happy, saying that this is the first time I experienced breathing on top of acupuncture. I really want to do it again. And another person says I want to keep adding breathing to my treatment and my daily life. And another one says I'm so happy all day afterwards, and it's like my day starts all over again, and I have never experienced this much happiness and energy. And then some also says that I feel energized, feel like my day started all over again, even at the late afternoon. And from the chi measurement from these patients, we also saw anywhere from 8 point to 10 point jump on their chi measurement before and after the treatment, and 100% improvement. I never seen. I mean, I didn't see any data going this way. Is going upward. So it was a really good success.
Yes.
So thank you.
Thank you.